Right, welcome back. Medical professionals from around the world are gathered at the Gallagher Convention Centre in Midrand. The aim of the event is to discuss, debate and share experiences based on African health and also to examine approaches to regional health challenges. Well, joining us in studio for an insight into Africa healthcare and the conference is Professor Sylvester Chima. He's a guest speaker at the event and is also a neurologist and pathologist in his practice. It's good to have you. Welcome to Morning Live.
It's a pleasure.
All right, so when one thinks of healthcare in Africa, poor administration, poor access to service, poor levels of education, these are just some of the issues that jump up and grab our attention. What is being done to rectify the situation?
Yeah, one of the things that we are doing is to have conferences such as the Africa Health Congress, which we're having at Gallagher Estate. This is an annual conference. This is the 4th edition of it, and we bring together health care professionals from all over the continent, basically, and all over the world, to talk about, ways of improving, the quality of healthcare service delivery in Africa. Yeah. To do this, what we have done is, for example, we have 14 CPD accredited conferences to which healthcare professionals, doctors, nurses, physiotherapists, and all the lot can come in, register, improve their skills, and also learn about new techniques, new equipment, and things like that, so that they can go and try to improve the service delivery in healthcare.
No doubt that assistance from the private sector is needed, and governments and private sector need to work together. How far are we in achieving a good relationship between the two parties?
Well, healthcare is everybody's business. Yeah. Okay, it cannot be left to government alone. But we also need, in terms of, because of it requires a lot of financing to actually fund healthcare services. We need involvement and of the private sector. Now, in terms of how far it has gone. Now, one of the things that's being done is, for example, the Africa Health is being organized by a private entity, not government entity, and with involvement of organizations and exhibitors and equipment manufacturers from all over the world. And the idea here is to be able to provide information and access, at least open up the availability of this information to healthcare providers in Africa who are not aware of the equipment that's availability of equipment. They are not. Some of them are not aware of new techniques, and so on and so forth. So we need a combined effort between both the government and the private sector to make progress.
Let's look at the continent, and if we have to look at the respective countries, which country is really pushing forward well when it comes to healthcare?
Well, in terms of healthcare, sub-Saharan Africa, South Africa is probably leading, the leading provider, because most people from West Africa, including Nigeria, places like that, they send patients to South Africa to try and get the quality of service. But it's not all there. Well, we still need to improve, keep on improving, because one of the things that happens in healthcare, new technologies are evolving every day. Yes, of course. As new technologies are evolving, people have to be exposed to it. And this raises, some of the things that we discuss in this thing. The most difficult thing to deal with in terms of ethics is because anytime you have new technologies, new ethical issues arise. Yeah. Okay, so one of the conferences that we had here was the 4th Ethics and Human Rights Conference, again, where we are looking at the ethical issues in reproductive health, ethical issues in, issues of negligence by healthcare professionals, issues of medical errors, how to minimize them, how to improve the quality of healthcare service and things like that. Yeah. So,
when you talk about South Africa, are you talking about our private healthcare sector or our public healthcare sector? Because unfortunately, there is a glaring difference between the two of them.
Yes, there is a difference, but the difference is based again on funding.
Yeah, of course.
Okay, actually the statistics is that about 80% of the South African population use the public health care service, but these are the poorer people, and only about 20% of them use the private health care service, which is of a higher quality. But like we talked about at the beginning, is a combined effort between government and the private sector, because the private sector brings in the funding. Therefore, people pay insurance and they get better healthcare service now. But apart from that, in terms of training, all the doctors and healthcare professionals are trained from the same public universities. Yeah. So really there's no difference in terms of their training. Okay, but where they service, some of them work in the private sector and some of them work in the public sector. Of course, we need to improve service in the public sector, but in terms of the training, the basic training of all healthcare professionals in South Africa, the standard is the same. But the practice in the private sector is affected by the availability of funding. In other words, they have better equipment, they have, they are able to pay better for their doctors, and therefore they probably get the first dip in terms of, in terms of health professionals.
Quite an interesting conversation and issue to bring up. A question that could be asked is reducing the reliance on international aid organizations to foster development of more local supplies a good idea when it comes to improving healthcare in Africa?
Decreasing international aid from international organizations, is that what you're saying?
Yeah, and not being so reliant and actually trying to develop it here locally within the continent.
Yes, it is true, but you have to understand the problems we have in the continent. Medicine is an international, it's an international field. Now, if we say we're going to, we have to be more self-reliant as Africans or in Africa. But one of the things is that most of the new technologies are developed outside Africa. And in order for us to be able to learn, we need to interact in terms of with international organizations. But saying that we need, the international organizations do a lot of work, and some of their work, like the World Health Organization, this work is supposed to help developing countries. And since Africa is developing, we should not be completely reliant, but we still need their assistance as we make progress.
Well, I hope that a lot comes out of this particular conference. Started yesterday, it's on until Saturday.
Yes,
and you have a lot of individuals from the continent as well as within the medical fraternity. Everybody here participating.
Yes, we have professors from Nigeria, West Africa, North Africa. We have people from Europe giving lectures. We have about 400 exhibitors, showing up their equipment from all over the world. And we have participants from all over Africa. We encourage people to attend.
Excellent. Thank you so very much for talking to us. So this is one of the speakers at the Africa Health Meeting, sharing some of the issues coming forth at the conference. Sylvester Chima is the Associate Professor and Head of Program at Research in Ethics and Medical Law at the University of KwaZulu-Natal. Thank you very, very much for joining us on the program.
Thank you for inviting me.
All right, let's take a break. We'll have more after this. Stay tuned.